Ask the Doctor by GPDQ. Expert medical advice for you, your family and your colleagues.
Hi, this is Lucas, and we have our clinical director on with us today, Dr. Katerina Kristalis. Hello.
Hi, Lucas.
Hello, and we are going to talk about Omicron variant today. So some really valuable questions that we would like to sort of touch on, and particularly the most common one. So why are we concerned about Omicron, and are symptoms more severe than the previous variants?
Perfect. Thanks, Lucas. So we're concerned about Omicron because the variant is thought to be much more transmissible than previous variants. We don't actually have enough data at the moment to know if Omicron produces more severe symptoms than previous variants of the virus. And in the UK especially, we've got a high vaccination rate, so it's harder to get a full measure and a full idea of how Omicron affects those that are unvaccinated.
And what are the symptoms? Are they different?
Good question. So the information that we've got at the moment from the NHS is actually slightly confusing because the NHS website still lists the top symptoms of a COVID infection as a cough, a temperature, or a change or loss in your sense of smell or taste. But these symptoms haven't been updated for over a year. And with the new variants, there actually been a change to the top symptoms. So the information that I've taken is from the ZOE study, which is the world's largest ongoing study of COVID-19 and is led by an epidemiology professor at King's College London. This study suggests that the majority of symptoms in vaccinated people are actually similar to the common cold and to the Delta strain of COVID. So this study suggests that the Omicron symptoms are firstly a runny nose, a headache, fatigue, sneezing, a sore throat or fever. So it's different to the symptoms that we've been told about many times that I've just mentioned. And actually this information and these symptoms mirror what I'm seeing in my own clinical practice as the most common symptoms.
So if an individual has these sort of symptoms, what should they do?
So firstly, isolate, as we know, and then to get tested. And we know that we've all got access to the lateral flow tests, but they might not be as accurate as a PCR test if you're symptomatic. And that's where the slight confusion is because of the difference in symptoms. So you can get a PCR test via the NHS if you've got the classical symptoms, so the cough, the fever, or the change in loss of sense of smell or taste. But if you have the symptoms that I've just mentioned, the ones that are actually more common according to the ZOE study, then you can get a PCR test through the ZOE study itself, through the ZOE COVID study app.
Okay, so and how should we almost like treat ourselves, or if we have symptoms that you have just mentioned, like is there any particular way that you would suggest?
Yeah, absolutely. So even though it's very difficult to tell the symptoms apart, so it's difficult to tell if you've got the common cold, the Delta variant, or Omicron, actually the good news is that with these symptoms, you can treat them all fairly similarly. So initially, all you need to do is rest, drink plenty of fluids, over-the-counter remedies, and paracetamol as you need it. So the maximum dose of paracetamol would be 2 tablets 4 times a day as an adult, so 1 gram 4 times a day of paracetamol. And that should be enough to treat the initial symptoms of either Omicron, Delta, or the common cold.
And is there a point of when we should seek further medical advice?
Yes, absolutely. So great question. If these measures are not helping you, so if you've tried the above measures and they're not helping you, or if you're experiencing a constant fever that's over 38 degrees, if you have a sore throat that is so extreme that you can't eat or drink, a cough with shortness of breath or difficulty in breathing, chest pain, or generally if you have worsening symptoms or concerns, or you have symptoms that are not mentioned in what we've just discussed.
Yeah, that's super valuable. Just one more thing, in terms of the booster, what's your stance on that?
Absolutely. So the ways to help keep yourself safe, as we know, as Boris keeps saying, is to get the booster shot, because it provides you with the extra immunity that you need to help fight this.
Yeah, no, that's super valuable, and thank you so much. Sort of clean a little bit of that light to us. So yeah, super valuable as always. Thank you all for listening. Do tell your friends, and remember this week to put yourself and your health first. Thank you, Dr. Katharina.
Thanks, Lucas.